in general, okay, and this is by observation of animals, if they have blood stagnation somewhere. And for this, the easiest way to think about it is think of those animals that have, for instance, they have a mass somewhere. I mean, a lot of the cancer patients, I mean, they have pain. They have real pain. Or the ones that have traumatic injury. They really do have a lot of pain. And they don't experience it in the way necessarily that humans do. I mean, but still, we know that the pain has to be pretty significant because most animals, you know, they're a lot more pain tolerant than humans. And so in general, there's a sharp pain at a fixed location that's more from a human perspective that can improve with exercise. Okay, because as you're moving the chi and the blood, okay, you relieve some of the pain. It's pain that intensifies with pressure, definitely in animals. There can be swelling and hardness of the affected area. Okay, there you can see discoloration of the tissues. This is, you know, something that you might see that it turns kind of purplish and red. You know, definitely when you see hematomas, there's a discoloration of the tissues. You can see paresis or paralysis because when there's intervertebral disc disease. There can be an obstruction of the nerves, and you will see paresis and paralysis present. Also, too, for animals that have gotten paresis or paralysis from traumatic injury, from being hit by a car, or also those animals that have been doing a lot of performance work, they'll strain or sprain something. You can see discoloration of tissues, but you can also see a lot of weakness involved. Sometimes if it's really significant and there's a lot of systemic blood stagnation or stasis, like there is in congestive heart failure, for instance, or cancer, advanced cancer, you'll see cool limbs, ears, and extremities in the lumbar area, especially if there's yang deficiency of the kidney, spleen, or heart. Also, clinical signs of blood stasis or stagnation by definition. If you see mass development, there's blood stagnation or stasis present. And that can be either internally or externally. Masses on the outside of the body or on the inside. We'll also see a dry skin and hair coat with dandruff, hyperpigmentation, and lignification. So the real thick elephant skin that's really dark black. Think of the West Highland White Terrier that should have pink skin and turns black and have really thick elephant skin underneath from chronic damp heat, obstruction of the channels and collaterals with blood stagnation, and all that itching. What you should see on here too, you should put on there is itching, okay? Itching, at least certainly for problems with allergic dermatitis. And I wanted to bring that up. A lot of the animals that have allergic dermatitis, chronic allergic dermatitis, that are given all those immunosuppressive drugs or antifungals, many times they can be treated very effectively by treating the underlying disorder, meaning treating damp and phlegm and heat and tonifying organs like the spleen and the kidney and the lung. But a lot of times in these cases, if the blood is not regulated, and there's any stagnation or stasis and the blood is not regulated, you cannot get the itching to stop and you will not get the immune system regulated. You will not be able to stop the itching and scratching of the animal. So the treatment of blood stasis and stagnation, particularly in chronic dermatitis cases, is really paramount. Because in order for you to treat the itching, you have to regulate blood.